For instance,
We'll be going live in about 3 minutes. Say that. We'll be going live in about 2 minutes. Afternoon, everyone. It's 2 o'clock. It's 2 o'clock, and it's time to begin our program. Make sure I've got all my everything muted I need muted. Thank you all for joining in. It looks like we have about 5 people watching live at the moment, and we usually have more join in a few minutes, and we have several people that watch later. I'll go ahead and give an update of our numbers. Right now, we have in a day, we have 423 total cases. We had 20 deaths, 326 released. That leaves 77 active cases, 76 isolated, and 1 in the hospital. That's for Adair, and Adair is currently in the red zone of community spread, meaning they're having 25 or more cases, average per 100,000 population. Casey has had a total of 283 cases, 16 deaths, 263 been released, leaving 4 active, all on home isolation or self-isolation. Clinton's had a total of 178 cases, 3 deaths, 136 released, leaving 39 active, 36 of those isolated, 3 in the hospital, and Clinton County is also in the red range of community spread. Cumberland's had 116 total cases, 0 deaths, 113 released, leaving 3 active, 2 isolated, and 1 in the hospital. Green, 306 total cases, 9 deaths, 278 released, leaving 9 active, 17 isolated, 2 in the hospital. McRae's had 228 cases, 1 death, 208 released, leaving 19 active cases all on self-isolation or home isolation. Pulaski's had 921 total cases, 12 deaths, 831 released, leaving 78 active, 74 of those isolated, and 4 in the hospital. Russell's had 316 total cases, 7 deaths, 276 released, leaving 33 active cases, all on self or home isolation. Taylor County's had 386 cases. They've had 7 deaths. They've had 325 of their cases released, leaving 54 active, 53 of those on home self-isolation and 1 in the hospital. Taylor is also in the red range of community spread according to our local numbers. I've had a few people ask why the Taylor County is showing up red in our local numbers and not on the state numbers. The state is a couple or 3 days behind the local numbers, so they will probably show up red on the state numbers today or this evening when they update their website. Total cases in Wayne County, 210, 0 deaths, 184 released, 26 still remain active, 23 isolated, 3 in the hospital. So total for our district 3,367 total cases, 75 deaths, 2,940 released. That leaves 352 active cases, 337 of those isolated, and 15 in the hospital. So for today, we've already got preliminary 64 cases today. Our peak day of new cases, we had 75 in one day, but on that day there was 2 significant nursing home outbreaks. So 64 is the highest community spread that we've had since the onset of the outbreak. When you're taking into account there's no significant nursing home clusters that's tied to where we are right now. For today, it looks like 8 for Adair, 2 for Casey, 5 for Clinton, 0 for Cumberland, 4 for Greene, 5 for McQuarrie, 8 for Pulaski, 13 for Russell, 15 for Taylor, and 4 for Wayne. And some of those, we may get some more by the end of the day, or a few of those may be transferred to another address or whatever, depending on how the investigation goes. But that's our preliminary numbers. If the numbers hold for Russell County, that'll push Russell County also up into the red range of community spread, 25 or more cases per 100,000. I understand a lot of the cases in Taylor County is tied back maybe to the university there. The way we count those cases historically is if the case isolates in the county where they're going to school, it counts there, and if they choose to go home to isolate to their home county, it ends up counting in the county where they choose to isolate. Since college students kind of have a dual residence, so we end up coding it to the county where they end up isolating. I think that's all of my updates. Stuart, Dr. Wayne, do you have anything to add? All right, so anyone that's listening in, if you want to add a question to the chat box, feel free to do that. We'll try to answer it if we can. We've got 24 people watching now, so if any of you all listening and want to have a question answered, you're certainly welcome to do that. The most common question I've had this week, this is not on the list, is why are schools that are in counties that are in the red remaining in session? I will remind you all that it's not up to the health department to close a school. By statute, the school board and the superintendent is the ones that have the authority to decide when schools will and will not be open. It would take an executive order from the governor or court order to otherwise shut down a school, as I understand it. So we provide the schools with information and they make decisions. I know it's difficult times. It's hard decisions to make whether you're open or closed, and I understand all that. But if you have a concern, the best people to address that concern to is the school board or the superintendent, and not for us, because it's not our call. So anything to add, Stuart or Dr. Wayman? All right, so question 1. Tracy's not able to be with us today, so I get to be the moderator also. Question one that we received this week says, why did the contact tracer ask if I have pets? Stuart?
So we know, according to CDC, that a small number of pets in the world, so we're talking worldwide, have been infected with COVID. If you are a positive case of COVID, you should treat your pet as a person and isolate from them during the time that you are shedding the virus.
That's certainly interesting. Not something I put a lot of time thinking about, but thanks for that update, Stuart. Okay, question 2 says, can I get reinfected with COVID?
So the COVID epidemic has only been around for about 10 months, so the research is relatively new with many questions still unanswered. There have been a handful of documented reinfection in people who had had the disease earlier. This is obviously very rare. We know that the antibodies wane short, probably within 3 months of the initial infection. However, we also have a cellular immune response, which we think would kick in if it was needed down the road. But occasionally you will get a person reinfected, and it may be because the strain has slightly changed from the original.
So, Dr. Wayman, I just wanted to, and I know I'm kind of hitting off the stuff here, but we know that there's a Chinese strain and a European strain, I think we heard. So I guess it is potentially possible that a person could get infected with both of those strains.
Correct. And I think some of those documented cases, that's exactly what happened.
And we wouldn't want this to be simple or easy, would we? Not like any of this has been simple or easy. I've got a note here to remind everyone, this week and next week, we're going to be doing our media brief as usual weekly. But after that, we're going to move to an every other week format. So if you're used to tuning in, tune in next week at the same time. And after that, we'll go to a every 2 week format. Just basically because we've been getting fewer questions. If we see the demand increasing in the types of inquiries we're getting, we can certainly increase that. So number 3 question, if I contract COVID-19, is it safe for me to breastfeed my child? Can I give breast milk to my infant child if I put it in a bottle for her so she and I will not have close contact with each other until I have a negative result? Will this put my baby at risk?
So no, it won't put your baby at risk, and yes, you can breastfeed. Many studies have shown that coronavirus rarely is found in breast milk, and on the rare occasion that it was found, it was non-viable, that is non-infectious. Wearing a mask would protect your baby. You wearing a mask would protect your baby, and certainly pumping and feeding by bottle is also a very good idea.
Thank you, Dr. Wayman. I don't see any questions in the live chat. Again, I'll remind folks, if you have a question you'd like for us to answer, please type it in. Question 4 that we had submitted this week, can people seated in a restaurant take off their masks? The kids can't at school. Or it says, why can people seated in a restaurant take off their masks? The kids can at school when they're spaced 6 feet apart in the classroom.
Okay, so children, they are able to remove their masks when it's lunchtime at school. So first and foremost, I want to let you know that they can, during lunch, remove their mask. Now, the reason why that children need to be masked at all other times during school is because of the prolonged period of time they spend in an enclosed classroom. And the more people that you have in a confined space, and the more potential there ends up being for this aerosolization or for the droplets to spread in and around the entire room. And so then others can become infected. Generally in a restaurant, you know, people go in, they eat. A lot of restaurants, that I've been to are trying to space people out even more than 6 feet, because they're only supposed to be at a 50% capacity right now. We know our schools are back to full capacity. Sometimes they're able to space the kids out, sometimes they're not. But, we know that by masking and spacing, that decreases the risk. However, again, in that enclosed area for a long period of time, that increases the risk then that even though they may be 6 feet apart, if they're not masked, then that potential is greater.
If I could just add something, I know wearing a mask is uncomfortable. It feels inconvenient. But, a few things I just want to remind people. Right now, we're at our highest level of community spread. It's spreading very quickly. We're on a sharp escalation. It's very likely that over the next 3 or 4 or 5 weeks, we're going to have an extremely, extremely difficult 3, 4, 5 weeks ahead of us. It looks like we're moving toward a very high spike locally and at the state level. We know that, 64 cases today. Our peak number of cases at any given time was 75, but that was with 2 nursing home clusters reported on the same day, plus the community spread. There's no nursing home clusters mingled in with this 64 we're having today, as far as I know. That's simply community spread. So we're in our worst place that we've been since the start. We know from our local data, I'm not using world data, state data, I'm using the data that we've accumulated locally on lab-confirmed cases and how those the outcomes turn into the results. We know that 1 out of every 50 people, a little over 1 out of every 50 people who contract COVID-19 pass away. We also know that right now in our district, 1 in every 12 and a half people, or just over 1 in 12, end up being hospitalized. So that's an awful lot of hospitalizations. It's a lot of pain, it's a lot of suffering. And if keeping your distance and wearing a mask can reduce that, which we know it can, and again, just looking at local situations that we've investigated where there's been significant clusters, by and large, it's been in situations where the people weren't observing the guidance. And in many, many situations where, people contract COVID-19 and they've been out, the places they've been to where they have been following the guidance of masking and wearing the distance, that didn't turn into big giant clusters. The clusters happen in places where people don't want to mask and social distance. We can tell you that without a doubt. That's happened in our district over and over. So, please wear your mask and social distance. We're in for some really difficult weeks ahead of us. We can definitely save lives and we can save hospitalizations by doing, just keeping your distance and wearing a mask. I wish that it wasn't such a controversial issue. For some reason it is, but I am for, please do those things.
Another thing that we have, I've heard it even this week, that this is not as bad as the flu. And I'm not downplaying the flu. Getting the flu is bad, and it can be really rough on you. But we know that it's much worse. And I think Dr. Wayman can tell us the numbers of, we've seen, 1 million worldwide cases, or I guess over 1 million worldwide cases.
For deaths, you mean?
Yeah, deaths. So,
let me look and see.
It's worse than the flu.
I updated this last night. So as of last night, it will have changed a little bit since last night. So at the world level, we've had 1,083,216 deaths. And during a really rough flu season worldwide, it's usually about 500,000 deaths in the world, and commonly it's about 250,000 deaths. So this has already been twice as deadly as a flu season. And in the United States, this has been about 5-6 fold times more deadly than what a pretty common flu season would have for us. So it's definitely a lot worse than the flu. Dr. Wyman, you want to add anything to that?
Exactly right. It is much worse than the flu. Probably primarily because nobody has any immunity, whereas people do have a little bit, at least, to the flu. From year to year, they have some cross coverage, unless it's a perfectly new strain.
There's nobody in the world that wants this to be over any more than us. It's absolutely wearing us out. You know, we wish it were over, but it's not. So we're trying to still encourage, do what you can to save this all from spiking too high before a vaccine is available. Question 5 says, when buying fruits and veggies at the grocery to eat raw, do I need to wash them with a certain solution because they may have come in contact with someone with COVID-19?
So there's no evidence of COVID being transmitted by food at all. On your fruits and vegetables, you always do need to wash those, but just wash those with running water, plenty of running water before you eat the raw fruit or vegetable. There's some vegetable washes out there available commercially, but again, that is not recommended by CDC nor the FDA to need to use those, as COVID, again, is not transmitted by food. There's no evidence of that. So I will say, let me add to that. I know I've heard some people talking about, well, you know, somebody at the restaurant not masked and they fixed my hamburger. Remember, the masking, COVID is much more, is prevalent from person to person, not to the food and then to you. And COVID is a respiratory illness. Generally, most things that we contract from food are going to be a gastrointestinal illness.
So it's not as likely to get it from eating it as it is to get it from breathing it.
Right.
I like to break it down into words I can understand.
There's no evidence you're going to get it from it being transferred to the surface of some food, then you eat it and get COVID.
I wouldn't recommend eating it or rubbing it in your eyes or anything else, but certainly the bigger risk can be prevented, or you can lower the risk in a much better way by social distancing and masking. That's the primary. But do certainly sanitize and take those precautions.
You're at a much greater risk for, if you'll remember a year ago when we had a hepatitis A outbreak in the state. Now that's foodborne, and those are the kinds of things that you have to look out for when you're eating foods. And hey, there's a vaccine for hepatitis A, so you can be vaccinated for that, and it lasts a really, really long time. I think that we said if you get both shots, 2-shot series, I believe it. I actually remember speaking with Dr. Williams about this last year. I think it's up to about 40 years that you have immunity.
And that epidemic hasn't gone away yet. It's still kind of trickling out there.
Hepatitis A.
Hepatitis A.
All right, we're getting close to the last question. We are upon the last question, question 6. So if there's anyone that's listening in that wants us to answer any additional questions, please type it in the YouTube chat box and we'll try to answer it if we can. Before we get to the last question, I'll say Stuart and I yesterday probably spent 45 minutes or an hour looking at the CDC's state-to-state comparison trend report. And, the best that we can tell, a lot of states has gone through just a few weeks ago what it looks like we're getting ready to go through right now, where they had about a month of a very, very high spike before it started plateauing and leveling off, dropping. And then, so if that's true, I mean, we've got a very difficult 4 or 5 weeks ahead of us. And it certainly, judging by our numbers, it certainly looks like we're ramping up for it. So
we're not lagging behind these places by much now. I think we saw yesterday that even the states with large peaks, like if you look at Tennessee, Florida, places like that, they're they came down, but now they're on the rise again, and Kentucky is kind of following that the rise that they're currently on.
Their incidence rate is higher than many of those states
Yeah.
who were really doing very poorly a few weeks ago. We're doing worse now than they are now.
Yeah.
Whether they'll have second spikes with flu season and schools going on, we don't know yet. Every state's in the same place with schools and flu season coming on us. But it does look like we're at the front end of a really, really difficult time. So, I mean, I can't say how important it is at this moment in time to wear your mask and social distance. We're getting ready to swamp our area with COVID-19. And like I said, 64 cases today already. That's the largest case of community spread. And over the last few days, it's just been getting more and more cases each day. So please wear your mask and social distance.
And remember, I think usually we're seeing deaths trail by about 4 weeks, things like that. So, if these numbers go up, then, like Sean said, that puts us in for a few weeks of rough times.
We had I think a 58-year-old death in Clinton County and an unofficial 52-year-old death in Clinton County, which it's unofficial. I mean, the person passed away. We know because we've seen it on social media and things. The family posted. We just don't have the official death records that we can enter it into our official reporting. But, having a couple 50-year-olds in the 50-year range died just recently, I mean, it puts it into perspective. It's certainly not just the elderly, the highest elderly. And certainly the more elderly you are, the more likely it is you're going to pass away. But we'll be getting close to probably 9% or 10% of our folks that have passed away being in the 50-year block, 50 to 59. So, something to think about. Okay, last question. I don't see any questions coming in on the chat. Question 6. If my pet is around someone with COVID-19, can they catch it from that person? And if so, how will I know if my pet has it?
So, again, this is kind of like that first question. Cats and dogs, they can be, or pets, but I think we think of cats and dogs here generally. It can be infected by COVID, but there hasn't been anything that shows that they pass it on to their owners. So pets can be infected by humans, but we don't have any indication that infected pets pass it to humans. So it doesn't go in reverse order that we've seen. Again, if you are positive, you should isolate your pet from you. It's not recommended to test your pet unless they show symptoms. And then if the pet is positive, it should be isolated from people and other vets until cleared by a veterinarian. And the signs of sickness in dogs kind of goes the same as humans: fever, coughing, difficulty breathing, shortness of breath, lethargy, sneezing, discharge from the nose or eyes, vomiting, and diarrhea. And if you would like more information on that, and we certainly are not veterinarians, but you can look that up on the CDC's website at www.cdc.gov/coronavirus 2019, and then just go and look up pets.
And I will remind everyone that we will have our weekly news brief, public brief that we're doing right now. We'll have it again next Wednesday at 2:00. But following next week, we're going to go to an every other week format. So let me remind you of that again. So if you like following us, we're going to change that up a little bit. Certainly, if we start getting a lot more questions, go back to the weekly format. I don't see any other questions. Stuart, Dr. Wayman, do you have any closing thoughts?
I just want to say, as we were talking about looking at other states, you can visit CDC's website and you can type in states and you can look at Kentucky and compare that to some of our neighbors in the south or to the east or west of us. And it's very interesting, and you'll be able to see that epi curve of how that's going, trending back up again. So, I mean, if you are interested and get a chance to take a look at that, also you can go to our website. John's put a lot of effort into putting data on there. You can compare all our county to counties, or you can compare our district to state or counties to state. You can manipulate that a lot of different ways to look at the data and follow the trends on that also.
So you can use the CDC website to look at state-to-state comparisons, and then you can use our website to do county-to-state or district-to-state comparisons. So kind of extrapolate how your county's doing. For our counties, most of our counties, the population size is so small that it's it's kind of difficult to look at a county with small population to wonder if the statistics are accurate. Is it a large enough sample size, that population? But with our district being over 200,000 people, I feel like that's a pretty good sample size to be accurate. So the district data pretty well runs, not a whole lot different than the way the state trend runs. And you can look at the state data compared to the national data. But again, any other closing thoughts? Let's see, Gail Cowan says on the website here. Let me see if I can, there we go. Thank you to all of your local and district health department staff for all you are doing. We couldn't get through this without you. Well, thank you, Judge Cowan. I appreciate it. I know in Adair County, it's really a difficult time over there. You've had a bunch of cases, and this is your second round of having a bunch of cases. You all had the early nursing home outbreak over there, so Adair County's not been spared the pain, that's for sure.
Unfortunately, right now, I think Adair County is running twice as many through the 14th of this month, twice as many cases already as they had in the total of 50. So, so right now, I think there's at 44 cases per 100,000 average. So that's really high. So, of course, we have other counties that's up in the 40s right now too, and probably some others that will join them tonight. But we went through this a while ago, in case people are interested. I'll just read it off. To get into the red zone of community spread, you have to have an average over the last 7 days of 25 cases per 100,000. So not every county's population, of course, is 100,000. So if it's 25 out of every 100,000, it would be 12.5 out of every 50,000. You can kind of just mark it down by, reduce it down by taxing the denominator and the numerator, and kind of back it down close to where your county is. But we've calculated it for each county. In Adair County, if you're averaging 5 a day, you would be in the red zone of community spread. That would calculate out to being at the 25 per 100,000. Casey County, if you get to 5 a day, you would be in the red. Clinton County, because of its smaller population size, 3 a day. Cumberland, of course, being our smallest county as far as population, they average 2 a day, they would be in the red. Greene County, 3 a day. Macquarie County, 5 a day. Pulaski, being our largest county, would require an average of 17 per day to be in the red. Russell, 5, Taylor, 7, and Wayne, 6 cases per day. So if that helps you to kind of, you want to look at the local data and see how many new cases you're getting, and to sort of figure out in your mind, are you getting close to being at that 25 per 100,000 spread? You can kind of use those numbers. So, all right, I don't have anything else. One last chance, Dr. William Stewart. All right, thank you all for joining in. We always close with social distance, wear your mask, sanitize,
and do the kinds of things that we've been saying to do since March, since this all started. We want to get through this, so help us slow the spread by doing those things. Thank you all. Join in next week on Wednesday at 2:00 for our weekly meeting, and then after that, it'll be 2 weeks after next week when we go to the 2-week schedule. So thank you all.